Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Methicillin resistant Staphylococcus aureus. Methicillin resistant Staphylococcus aureus. So this is the Staphylococcus which is resistant to the antibiotic methicillin. That means how are you going to define it? So if the methicillin, the minimum inhibitory concentration of the Staphylococcus in the methicillin is 8 microgram per ml or more, or if the if the minimum inhibitory concentration of oxacillin of Staphylococcus aureus to oxacillin is more than 4 micrograms per ml or more, then we call it as methicillin resistant Staphylococcus aureus. That means in these with MRSA, they are either resistant to methicillin or oxacillin. Why is this resistance seen? This is because of the MEC-A gene mutation. This is because of MEC-A gene mutation. Whenever there is mutation in MEC-A gene, the penicillin binding protein gets changed and it gets altered to form penicillin binding protein 2A. So this resistance is actually chromosomally mediated, and this penicillin binding protein 2A is the most common mechanism which is seen in methicillin resistant Staphylococcus aureus.
thank you and thank you for watching.